welcome to a new podcast episode for Radiology AI. My name is Dania Daye, and I'm the Associate Editor for Social Media for Radiology AI. And today, my co-host Paul Yee and I are very excited to bring a new episode of the podcast series. Today, we will be interviewing Dr. Judy Gichoya and discussing her journey in the AI space. Judy, thank you for joining us. Judy is an Assistant Professor of Interventional Radiology and Informatics at Emory University School of Medicine. She received her medical degree from Emory University in Kenya and completed her medical internship at Kiambu District Hospital. She earned a Master's of Science in Health Informatics from Purdue University. In addition, she completed postdoctoral training in informatics at the Regenstrief Institute in Indianapolis. She also completed a residency in diagnostic radiology at Indiana University. Prior to arriving at Emory, she completed a fellowship in IR at OHSU. And now at Emory, she is co-director of the Healthcare Innovations and Translational Informatics Lab, HITI, where she is studying the future of work for the augmented radiology ethics of AI, workflow, and operational informatics. Judy currently heads the RSNA Radiology AI Trainee Editorial Board and is the co-chair for the SIM Global Outreach Committee. Most recently, she has been named the NIH Data Scholar at Fogarty International Center. Judy, we are very excited to have you here with us today. I will turn it over to Paul for the interview.
Dania, thanks for the introduction. And thank you to you, Judy, for joining us on the Radiology AI podcast. I'd like to start out by talking about your background, because it's really interesting. I know bits and pieces that I've heard over the years, knowing you through the different societies like SIM and RSNA. And I know you've been kind of all over the world, done work in IR and informatics. But could you tell us about your background and what got you into informatics in general, and specifically in AI?
So really it was, I always say this, I think if I would summarize it with a sentence, it comes down to, being at the right place at the right time and also realizing it. So I'm a foreign medical graduate. I went to medical school in Kenya. And surprisingly, at that point, we were still undergoing another pandemic, which is the HIV pandemic. And medical school in Kenya is 6 years in duration. And what happens is that at the end of the 4 years, in year 4, you start going to the clinical area. You're very, very excited to sort of work in the patient area. And when I was sort of going in there, I was very, very disappointed. But by then, I was starting to play around with IT. And it came out of laziness, really, because I was too lazy to go maybe get out some notes from someone else. And myself and a friend of mine called Felix Chiang ended up connecting, buying a hub and putting up a LAN that would connect both of our rooms, because there were several floors and there was one side for boys and one side for girls. And so I ended up tinkering around things, and I had always been someone who tinkers around, and this curiosity that actually hasn't gone away, which is I wonder what happened to that patient. And so sort of being at the right place, right time, I ended up, there was a Dr. Buck Mamlin, who's the son of one of the founding fathers of this big program that provides HIV care in Western Kenya, was visiting. And he's a super geek and also a physician. And so, during that time, I started getting involved in working in open source medical record system. Then they were trying to build an open source medical record system for HIV care in Eldoret. And so it took me 2 weeks to get my laptop set up with the system. And I ended up starting to know more, getting into the community. And so I really started working in health IT before I knew what the term informatics meant. And so at that point, there was some funding to train physicians in informatics, and I got the funding. But it was always this community based, and I knew someone who knew someone, and that's how I ended up knowing and picking up a lot of the skills. So those early foundations were very important for me, because number one, they helped me gain a lot of knowledge. And, still, I think you may notice, I'm not trying to simplify the work of engineers, but you may have noticed that it's easier to train a medic into data science more than the other way around. And so picked up a lot of skills that I would say have served me well, even when I think maybe I don't know that thing or something else like that. Yeah. I've dropped some of the things like programming in Java, but overall I've kept most of the things that I learned then. And so when it came to AI, really, it was when I don't know if you remember a few years ago when big AI giants were saying we should not train radiologists. And I was like, man, let me check out what this AI thing is. I went and I remember I actually enrolled first in a TensorFlow course, and I was asking the TA on the course, like, oh, what are these parameters and what's this random initialization? It's like, they're random, you just have to do it. And I was like, this is a terrible way to learn. And then Jeremy Howard was setting up his course, and he does this cat and dogs with like 3 lines of code. And I was like, wow, I see why there's the concern. So really most of my technical skills are actually self-taught, but the principles and the science of around health informatics, rethinking your mind frame, I did do a master's degree in that.
That's really cool to hear. I remember seeing you for the first time, I think meeting you for the first time a few years ago at the SIM-CMIMI conference when it was in San Francisco. And Jeremy Howard was actually the keynote speaker and talking about how he wanted to democratize AI and deep learning. And so it's been really cool to see how things have changed over the years, and especially your trajectory. So speaking of that, you've recently joined the radiology department at Emory as an assistant professor of interventional radiology and biomedical informatics, as well as starting off a new lab called the PT lab. I've always been interested in knowing how these exciting labs and research groups get started. And, I've certainly been really excited about the work that you and the team there have been doing, presenting at different conferences, publishing in journals like Radiology AI. So I'm curious, what's the origin story of the HET lab and how it came to be? I know there's some different players involved and different folks. Yeah. I'm sure that'd be pretty interesting for us and our readers.
Yeah, so, when same thing, open source, I got to know all these new people. But when a few years ago, one of my really close friends, Aptashi, came to Indiana, and we had known each other for many years and had never met in person. And so when he came as faculty at Indiana University, where I had gotten my master's initially, he came in and was going to set up the lab for his students there. And I helped him set it up. He will not admit it, but I want to go on record by saying I helped him set it up because he's doing really well. But so he ended up working on, I started seeing sort of like what was his ethos. And this is something that unifies us to do interesting and impactful work, And so the students then, like our students would not even know how to program, but they're becoming into a health informatics lab. And, it's just sort of, you really are reaching the last mile. It wasn't competitive to get in there. But what I learned then was, number one, you needed to put in a lot of investment in the infrastructure. And I've told you this because I know that you will be sort of following a little bit like in these footsteps in a few months. And you have to put the infrastructure, do the plumbing work that no one likes. But I knew that even from my global health work before. You have to do the work that's not, it doesn't win you a Nobel Prize, but it's super important for any work to go on. And so for us, it meant IRBs. It meant thinking about the data centers, how to get into the data center, no longer buying PCs with GPU to move to servers, thinking what's the cost of cloud versus on-prem, right? Because cloud may be ultimately cheaper if you can optimize, but if you want students who are going to make mistakes, then cloud is very, very expensive. At least we've had to pay a very big bill for that. And so, and then looking for people you have chemistry with. So when I started, I talked to the vice chair for research at Emory, Dr. Krupinski, and my boss, Dr. Safta, and I said, I want a lab. It's not usual for, medics and radiologists to set up labs, but I think a lot of informatics teams are starting to do that now. But, I said, I want to set up a lab. It's okay, it can be virtual, but hopefully when the campus opens, we'll finally get a space that we can all hang out and have this wonderful geek place to, just hang out, drink coffee, and just code. But so I worked more on the foundations of sort of like what makes successful student recruitment. And then I leverage my networks to recruit people to work with us. And so my co-directors and co-founders are Dr. Banerjee, who actually started around the same time, in Emory, and then Dr. Trivedi, who is 1 year ahead of me. And both of them were aligned, and we all play a very different role, So Imon teaches a lot of students, and so we is in charge of advancing that. I would say mine is more of making the noise and setting up the infrastructure, and I think that's something I'm good at. And Harry is just excellent with data sets and advancing sort of like very good project management. So that keeps us all on track for things else. You're just doing fun things that are not getting productive. And so that's worked out very well for all of us. We started getting a good reputation with our students. And then after that, honestly, once the students, it's became word of mouth, oh, I'm going to do this, and this other person, and this other person. And so now it's become super competitive actually to join the lab. Other strategies that we've done are to pair senior and junior students. So I think right now almost every PhD has a paired undergrad student whom they work with, and they have to co-mentor, and then we still overall do the mentorship. I told you have to also be very organized. So for us, we rely on Slack. We document a lot. Actually, we record pretty much, I would say 98% of our stuff, and it's posted somewhere. So when I'm onboarding someone, it's very easy because I just have to tag them at that video that I knew was for orientation or something like that. We had weekly lab meetings, which was super important through the COVID time, because we have we just don't have enough, like I said, we want ultimately to have a space where people can drop in. Like if you're in Atlanta, you can come see or, and hang out a little bit. But what we ended up was having a strong virtual presence, changed our formats for presentations. And so now our lab formats are primarily actually you give a talk around your topic of research. So, and then people ask you questions. So it's a good way to educate and also to get feedback on your project. The interesting thing that actually I haven't even announced yet to outside the lab is that as of this Thursday, we're going to kick off a new way of doing journal club in our lab, where we're joining with Ron Summers' group, students and the Stanford students for a joint journal club twice a month. So work on the non-sexy things, get people you have chemistry with, and just create an open source community. It's this idea of village mentorship that I actually got from someone who I consider a mentor of mine from MIT, and it works and it's fun.
That's really cool to hear. And I think I hear a lot of really, avant-garde, maybe ways of thinking about trying to build a lab, not just from the infrastructure, but also the culture. But speaking of some avant-garde things, you are the inaugural NIH data science scholar at the Fogarty International Center. And that's something that I've heard a little bit about Fogarty in the past with some friends working in public health. I've heard about the NIH, but I'm not familiar with this particular role. So for myself and our listeners, would you mind sharing with us about what this new position is and what your work is going to entail? I'm sure it's going to be really exciting.
Yes, it is actually. So you're right. Fogarty is the international unit of the NIH. In the past, maybe it would require a long explanation to explain why global health matters, even for security, right? If places are in chaos and people are not safe, then they can travel and you can have a pandemic. This is something we've all gone through the last year, right? So you can see why it's important for health to still have this international cooperation. And so this data scholar program was actually started, last year. I just started my position in February, and what it does is that, the NIH still with all its centers, works also in a very siloed way, right? And there's clear vision that data holds a lot of promise to advance health. And so they identified these key areas where data can make a big difference, right? So, and with that, they sort of appoint these data scholars. Actually, they're recruiting for the next batch, so you should just check it out. Honestly, it's a fantastic program. And what happens is that you are assigned to a unit and you end up working on them. So my work really is on harnessing data science for health in Africa, specifically working on an open data science platform. And so it's been great to sort of talk to people who are collecting data, but it's not just collecting data or providing an infrastructure to say, okay, this is Kaggle for Africa. It's saying, who are the people in the ecosystem? What are their needs? And what are the barriers that make it impossible for them to have fair access to data? That is that they're able to find the data. It remains accessible and interoperable and reusable. And so my work is to start to align these stakeholders' objectives. So you could imagine one thing is that I'm going to do a big project management of many, many stakeholders to actualize this. And then there are many pillars that are being funded here. There'll be a command center, which is a coordinating center that organizes the initiatives of the Data Science of Africa initiative. And then there'll be training programs, improving the pipeline, and then a research arm. And all those things need to be organized and integrated in this open data science platform. So I would not even call it a platform, I would say community, because it requires people, it requires you to rethink about, for example, it's saying, in Africa, we actually have a project called H3A, and this is a big genomics project. But if you were to say, oh, what's the genetic basis of, let's say, a cancer in Africa, right? You'd have to really be thinking, okay, where are the oncology registries, right? And then what are the genomic markers? What's the environment markers? And so if you're going to do that type of research, then you need to have access across multiple data centers. And so in the ideal world, something like the open data science platform, how it would work is that it would manage your authentication details, understand what's my privileges across all these three data sets using probably a unique research ID, and then go back and say, okay, I am going to track, this is the data that I used. These are the data commons that unify across multiple data sets. And then it makes it easier for people, it lowers the barrier for people to use data to answer interesting clinical questions. So, you're right, this is a dream job to have an opportunity to serve, my home in this capacity, and also very early on when it's being set up. And they are really smart people at the NIH, so I'm also learning a lot. It's again, like that time I'm telling you that I put in a lot of time to learn around open source and do a lot of technical teaching. Now I'm learning a lot of sort of, just a different lens of how data are used and some of the things that have to be made for this data science to scale in limited resource settings.
Thanks for sharing. I think it sounds super cool to hear about how the NIH is really not just trying to lead at the forefront of data science, but maybe on some of the more practical and, really human kind of level factors. So things like you mentioned, like training and trying to make this data accessible, not just having the latest data available to the top 1% of the world, but really to pretty much anyone else who might want to have an interest. Speaking of this kind of human aspect, another hat that you wear is as the director of the Trainee Editorial board for our journal. And it's been a board that I've been privileged to be a part of the past couple of years. And I believe it's actually the first amongst the RSNA journals to have a Trainee Editorial board. I think now Radiographics has one, Radiology has one. And so could you share with us the story behind this? Because, I basically saw an advertisement, I applied, I was really excited to get in. But I'm sure there's something pretty interesting behind there. I think one of the cool things about this journal is it's really new. So I think we've had a lot of flexibility to shape things in maybe new and unexplored ways. So I'd love to hear a little bit about the background.
Yeah, Paul, you may not believe this, but it's again, right place, right time. And Chuck, actually, they advertised for an associate editor for social media. But then I was doing a lot of the work for generating this ACR AI, sort of like I would have these journal clubs, we call them journal clubs, but I didn't want to read a book and an article. And so what it ended up, I would have these panelists and I would interview them, and it actually gained popularity a lot then. And, and so I think Chuck envisioned that I would be sort of someone who fits well in the social editor, the role that Dania plays. But when we talked, we realized that was not the role for me. And during the sort of like the interview process, after I'd said, okay, this is what I want, and I wrote the proposal and said, I believe that this is sort of like what's more interesting and what I'm interested in doing. And it's almost like having the Stanford happy hour before it actually happened, and so because of that, I ended up, just talking to him. He said, EMEA has this editorial board. Maybe we should do something the same. And right place, right time. So I ended up starting it. But Chuck's mentorship has been super important in this because there's just, and also really the RSNA staff, honestly, Crystal especially, because there's a lot of, sometimes when you're doing these service works, and this is like advice for junior faculty, is that you don't get the support you need, and so you don't succeed in it. And this is like the thing that I completely hang on to. And when I read the first applicants, I was like, wow, I should not be leading this, because they are like really, really smart people who are part of the TEB. And so what worked for us is that same thing, we got very smart people, but we also had this loose structure that allowed us to define what we wanted to do with it. And honestly, right now, I'm just a messenger because it just keeps accelerating. People will be like, oh, we should do this. Oh, you know what? Maybe we should go to Clubhouse, which I know you're going to ask me what to expect in the coming months, or maybe we should do this something differently. And so for me, primarily, honestly, I think we have very, very good leadership from Dania on the social media side. I wanted this to be an opportunity to lower the barrier for people who want to get to research and get to know people who are in this research space to have this opportunity. And every day we have a call every month with Dr. Khan. And what I tell him is that, yeah, we can do all these things. We can be busy. We can come up with all these webinars. What's the most important is to give that editorial, a hands-on editorial, intimate relationship that really is just rare, or it takes you a long time to get to know the same people. Now, if you're coming from a big institution, those giants tend to be in the big institution, but that's not what I envision. So we got a lot of international perspectives, a lot of international applicants, not just in radiology. We also have radonc, physics, computer engineers. And then, so that brings sort of richness to the group. And then we've changed quite a bit. Now we have these invitations every week. You can sign up and, you can sit into the sort of like the editorial team as they vet papers. And I mean, that's just invaluable because I'm going through the same sort of process at the NIH. I'm not giving feedback, but, seeing how the grant process, starts from start to end. And that these experiences, take years for you to accumulate. And so I wanted that to be the opportunity that, you could say, yeah, Dr. Khan knows me by my name. He may not remember me behind a mask because we never met at the last year at the TEB party, but, hopefully every year we'll have a TEB party at RSNA and we get to know the editorial process. So primarily that's our foundation of ethos. We give you a chance to review papers. We give you a chance for co-authorship. So Shinjini wrote one of the most downloaded, I think the second most downloaded paper. We provide this, specific webinars where you can have, giants in the editorial process come in and talk about their work and give you suggestions for your work. And so the flexibility, I think, has been what's been most interesting. And also because it's backed by people who are just hungry and just super smart. I always wonder how I'm leading this, really. I think I'm just here to provide the structure.
Well, Judy, I think you're not giving yourself enough credit, but I've certainly really enjoyed being part of the TEB and your leadership. I've definitely seen the whole adage of being in the right place at the right time, because I think that even this podcast, without the TEB, Dania and I wouldn't have met. And honestly, I think it was like the second to last day of RSNA. I ran into her and I was like, hey, I was thinking about doing this podcast. What do you think? You think it's a good fit?
Yeah.
And the rest is history, I guess. We're coming up on our 1 month anniversary of the podcast. So
I want to say, if you're out there and thinking of what am I going to do for the TB, this is exactly it, right? So you come up with an idea, you have access to, I don't even know, it's more of the structure, right? I can't say that, well, I said, oh, you should go and do this. I have never told anyone like that. We just say, hey, wouldn't this be interesting to write about or blog about? So those opportunities come, but we just have, people like you who are always trying to say, I'm going to do this. And so that's been what's made the TB very successful and very lively and a little more advanced beyond the other TBs that we see.
Yeah, so speaking of some of the liveliness and the fun things going on, what are some things that our listeners should be looking out for from the TEB in the coming months?
So we are, again, at the suggestion of the, fantastic TB team, we're going to have working with Dania. So now these two projects are very intimately related, is that we're going to have the bits and bytes, summary, 4 minutes, less than 4 minutes of, journal articles. I think that's such a great way. If your commute is 20 minutes, literally you could listen to 4 paper summaries as you go to work. And so we hope that will be very well received. Please check out our YouTube page that's coming up, so you have a chance to listen to some of the webinars we give to our TB members. We're hoping to try out this Daniel has been very good with the tweet the tweet chats, and the TB members are very intimately involved. And I know that we are trying, actually, your suggestion again, Paul, which is to have this it's not the happy hour, but just sort of like coffee hour, just these casual conversations. And so I do anticipate that we will see that come up either on just sort of in Zoom-ish formats or at Clubhouse. I know we've talked about that. Again, another idea from a TB member. We also have a special issue that's not been announced that's going to be co-edited by, 3 TB members will be co-editors. So I think that's a fantastic process to understand what it takes to have a special issue.
That's certainly a lot to look forward to for the TEB, and I'm excited to be part of it. I'm excited to really also get a lot more of the community involved. You mentioned Clubhouse, which I think is a really interesting new platform, because it kind of takes the webinar and allows participation kind of on a larger scale, maybe akin to being in a big auditorium or a big, open place where you can have some keynote speaker or have some luminaries talk, but also have Q&A from the crowd. So I think that's going to be really exciting, especially since I personally don't know when the next time we're going to have large in-person meetings are. So I think it's going to be a welcome change. As we move into the last few minutes in our time together, I wanted to give you a chance to talk about any topics that you're researching in the ED lab, any things that you're finding particularly interesting. I'm sure that what you're interested in, what you're researching will be of interest to our listeners, whether they're in computer science or in radiology or anywhere in between. So could you pick maybe 1 or 2 topics that you're most interested in, things that you're most passionate about, and give us a little bit of a rundown?
So, with this job with the NIH, I've had to sort of personally focus my research, and this is a good thing. So I'm primarily just working on 2 areas. One is, everyone who knows me knows that I'm obsessed about this, is validating models in real life and testing how they feel. And so, and actually the second one are pretty related, is this idea of operationalizing fairness when it comes to machine learning and AI. And we have a couple of projects about this. So we have a paper that's coming out that was just looking at the ICU scoring systems. And primarily people use the Apache 4, SOFA, and OASIS score. And we looked at the public data sets, the EICU and the MIMIC data set. And we were analyzing what's sort of like the rates of discrimination in those data sets. And actually, if it's high, you're pretty sick. But it's very poorly calibrated for Hispanics and Blacks. And so what that means is that if you have 1 ICU bed, now that may never have been something people imagined before 2020, but if you have 1 ICU bed and you have to choose who gets it, you're going to give it to the person who has a high chance of survival. So if these prediction scores are saying, look, that this Black patient or Hispanic patient, is most likely going to die, but it's artificially not, well calibrated, then you can actually divert care from specific people. And so I don't want to be the researcher that just says, that data set is unfair. I want to figure out how does it operationalize? How do you fix such a bias? And so we've been working on a chest X-ray project that's garnering a lot of crowd, because I just think we just ended up having this really great group to talk about bias. So the first thing that Ramon, my PhD student, did was to do benchmarking and just benchmark on all data sets, including Emory. What are the fairness metrics? When you look at the fairness toolkits, how do those perform? And what we observed, even when we have different, so the thing about Atlanta is that we have quite a high population of African Americans and white patients. We don't have a lot of Asians, but we observed sort of the same persistent patterns for bias as we move from the public data sets and we come to the Emory data sets too. And we also have friends in other places, and we hopefully that we'll be able to do this project to multiple places. But then in the process, we started to find these new proxies that we cannot really explain why it's happening. And so right now we are in a debate and these rapid experiments to try and figure out, is it the model or is it a hypothesis that's wrong? But there's something that's going on with this sort of like when you start to look at this subgroup analysis of the data sets, that's very concerning in terms of thinking about the underlying biases that may not be intentional to you as the model developer or the researcher that perpetuate across a project. But on the other hand, when we're not talking about the gloom, is that, I know that you actually presented a paper last year on just male gender detection using just male radiographs. And so we see quite a bit of work, I think, being done around this. I personally think it's a very interesting area where we're coming up with new metrics and new proxies using machines to tell us how maybe they can eliminate some of the disparities. So one of the works that we'll be actually doing here is, I don't know if you saw this piece of work that was published by Emma Pearson and Ziad Obamaya, who looked at the NIH osteoarthritis data set and came up with a new scoring model for osteoarthritis instead of using the KLG score. And they found that algorithmic score actually, narrows the disparity where instead of the poor scoring that was observed among minorities, people of low socioeconomic status and low literacy levels. And so I'm excited to sort of bring that into sort of like another rigor, first validate and just see how it performs on our data set, look at how it performs on a longitudinal data set, and then do a reader study to do this. So we're doing similar projects where we're just taking people's work, bringing it in, curating data sets. Like I said, work on infrastructure. So we're able to generate data sets in just a few days and then testing them without the data ever leaving. And so that's shortened, the barrier, which has always been something of interest for me. So actually today we were just reviewing some work. We are collaborating with, Connie Lehman and Regina Basile from MIT. And we found very discrepant findings when it comes to African Americans and their breast cancer risk model. So these are not like hypey topics, but they're hard and they can only be done in a multidisciplinary team, I believe, because it's very hard to say, I'm the expert in this. You need the computer engineers, you need to speak their language, and they also need to listen to you. And you need more radiology eyes to see this type of work. So I'm excited about developing new metrics and validation of our models using new data sets and just also in real life. As you know, we have a few companies that are coming in to do validation with the HITI lab.
That all sounds incredibly exciting. And, personally, I think that the past few years in radiology, we've had a lot of papers that have really been proofs of concept. But I think what you're talking about is, well, how do we move that from the lab and really move it probably a step or two closer to clinical deployment, which I think, as you're alluding to, is going to really require that validation, not just for performance, but potential biases against groups that might not be reflected in things like the area under the curve or pure accuracy. Mm-hmm. So I'm really excited to hear more and learn more in the coming years and maybe even collaborate in the future.
Absolutely.
So we're moving into the last minute or so in our talk together. Something that we ask all of our guests is, what are you most excited about for the next decade in radiology, in AI, informatics, or anything in between?
So today, maybe I'm just biased because we just are upgrading our, I'm an interventional radiologist. We're just upgrading our rooms to have a live streaming and immersive virtual reality and for cases. And so this is going to, I'm excited about that because I think fundamentally, I would say maybe what I am excited about is to maybe see more democratization of AI so that it's just another skill that you can use. Whether you have a baby at home and you're like, oh, you're not understanding this, fine, maybe you may not want to code for something, but that you understand sort of like you always use data science. Let me not specifically use AI, but you always use data science in your work. I think that will be fantastic. And so I do think this area of education, and maybe because I'm now thinking a lot more about how IR is taught in developing countries and what technology the gap it can be used to bridge. So I'm excited about that. And I think that's something that we will be working on here in just a few weeks. Actually, tomorrow I have my first training to become a super user of the system. And the second thing is this idea of understanding who our patients are when they're not in hospital. Just imagine, the other day I went to the store and I was buying a light to replace in my house, and this light was Wi-Fi enabled. And I was taken by surprise, because for a long time, people would say the cost of making a device smart is coming to zero. And imagine now that you don't even have to pay for a smart home, right? You can make your home smart now because you have all these light bulbs that can actually talk to each other, decide when to turn off, when to turn on, right? And maybe, who knows, that their sensors are getting so good that instead of wearing my Apple Watch or whatever sleep monitoring device that I have, that this may even understand what the temperature of the room is or how many turns I'm making, right? Now, we find that to be too intrusive. But this computing at the edge, okay, computation at the edge, which is in people's homes, can really give us a sense of where our patients are, hopefully more than 95%, because you get to see them 5% of their time. And so this idea of bringing care to the patient and also seeing this complete picture of wellness instead of illness, I do believe is really the return, the big return on investment. And that's, I just think that people are collecting much more data, whether it's because they're tracking their exercise or the food that they're eating because they have this smart fridge or smart microwave. I think it, in terms of invasiveness, it's too much, but this is where the world is going. If I can buy a bulb that's Wi-Fi enabled for $10 or $15, in a few years, I wouldn't buy a normal bulb anymore.
Yeah, totally. I think that while in our current paradigms, it seems really intrusive, when we consider things like late Dr. Sam Gambier from Stanford, one of his projects that was really cool was a smart toilet. When we think about intrusiveness, basically it's a deep learning vision model that learns the signature of your bottom, and it's going to analyze your stool, your urine, hopefully for early cancer diagnosis. So I think that, in the grand scheme of things, light bulbs are probably maybe amongst less intrusive things. So I think it's really exciting as well.
Mm-hmm.
So Judy, I think we're coming to the end of our time here, but thank you again for your experiences as a leader in AI, in data science and informatics and IR, and last but not least, the Trainee Editorial Board. It's been a pleasure and appreciate your time.
Thank you so much, Paul and Dania, for the invitation. And, thank you again for being on the TEB. And one other thing that I didn't talk about is sort of, we have recruited in terms of diversity, in terms of gender and skills, but we still don't even have a single Black TEB member. And so I hope that people who are listening to this can really feel that they can join in and have a blast. And so that would be amazing. By the time I leave, even we could have just a few more Black and Hispanic people.
Yeah, totally agree. So everyone out there, if you're interested, please do apply.
Awesome.
All right. Well, we'll give it back to Dania.
Thank you, Judy, for such a great discussion, and thank you for sharing with us your journey in AI. What a great conversation. To our listeners, thank you for tuning in to our March podcast episode. Don't forget to rate, review, and subscribe to our Radiology AI podcast series on any of iTunes, Google Podcasts, or Spotify. Please stay tuned for our next episode.